What's going on, ladies and gentlemen? It's your boy Brad back with another video, and it's been a year since I graduated from nursing school.
Are you listening? Nurse Pass. Beast mode. Grinding. Yeah.
Super crazy. Like, it's really crazy. It's almost like, you know, if you're not paying attention, you miss it, man. This first year's really flown by quick. Now, granted, I haven't been a registered nurse for quite a year yet. I took the NCLEX in January. Took it in January, started work in February. But it's been a hair over a year now that I graduated from nursing school. And I kind of wanted to talk about it, you know, what it's been like, man. Like, a lot has transpired since then, you know. I went on and took the NCLEX and I passed that, and you know, I went through a whole critical care academy, you know, learning what it takes to be a critical care RN, and then getting hired into my first job on a cardiothoracic surgical ICU. It's pretty awesome, but it's also very mind-blowing to think how far I've come in such a short amount of time. I kind of want this to be motivation for those of you out there who may have just graduated and you're about to be taking the NCLEX and you're about to be embarking on this first year that I just completed. It gets better. Whenever you first start, it's a shock to your system. It's very hard to make that transition from nursing student to nurse. Very difficult. But it's a process every day, and every day it gets better. And you know, the age-old saying is practice makes perfect. And although we are far from perfect, we grind every day toward it. I put a picture up on Instagram where, you know, I was basically showed this picture of all of these IV pumps and all of these drips and lines, and you know, these were some of the things that I was seeing, you know, my first couple of shifts through the Critical Care Academy. And I remember looking at that and looking at all of these medications, man, like you got fentanyl, white and with propofol, white, you know, with Precedex, whatever it was. And it's just like, you're looking at all these things, and then you're looking at this patient who is like super sick, and you're thinking to yourself, how am I going to be the person doing this? How am I going to do this without a preceptor? Very scary. Like I said, it will get better. It just takes exposure and it takes time in these settings. But it's very awesome. It feels great, you know. 3 years ago, whenever I was embarking on prereqs, I couldn't have imagined that although I knew what my goal was, for some reason I couldn't have imagined that I would have actually made it into nursing school and then passed nursing school and then got my dream job, really. And so just as a little reflection, man, it feels awesome. And I hope the feelings of success that I have and of the happiness that I have with my grind and where I've come and, you know, how far I've come is encouraging to you guys out there as well. You know, you may not want to be a critical care nurse. You may want to be a labor and delivery nurse, or, you know, psych nurse or ED or what have you. It doesn't matter. You know, whatever you want to do, that's awesome. And for my little journey to show you that whatever facet of nursing you want to go into, whatever that dream job is for you, that you can indeed achieve it. You can obtain it. It's doable. It's possible. Pour yourself into your craft, ladies and gentlemen. It's the best piece of advice that I can give you, especially once you've graduated from nursing school. It's true in nursing school. Being a nursing student is your craft, and pour yourself into that craft. But more so, especially once you graduate and you are now a nurse and you're learning and you're absorbing and you're taking everything in, pour yourself into your craft. It will pay back dividends to you, and you will be a much better nurse for it, and your patients will be much better off for it. That's kind of my first year, man. Very awesome, very surreal, very rewarding. And I'm very excited to see what this upcoming year has to hold. I'm going to continue to grind to be the best nurse I can be, and I hope you do the same. If you're new to the channel, be sure to hit the subscribe button down below. Putting out content every week to motivate, uplift, and inspire you to be the best damn nurse you can be. It's your boy, Nurse Bass, and I'll catch you in the next video. Peace.